I'm going to talk about shoulders, just one thing, and it's the heavy concept. The heavy concept says that right now, if you're, and I'm using my hands to talk, but if your hands are down on your lap right now, or touching your thighs or the sides of your thighs, and you try to bring them up in front of you, but you imagine that they're too heavy and they won't come up, and they're too heavy and they won't come up, and they're too heavy, that's the heavy concept. And the heavy concept just relies on your brain to know that you need to engage deep tissue muscles before you start using the more superficially placed ones. This is the example I always give. People doing the wave in the stadium, this, in order to lift their arms, their head has to come forward. Sometimes I wonder if they don't give themselves self-induced whiplash. Anyway, before our arms come up, there are deep tissue muscles that should be firing to anchor you so that your core is safe and so that the joint is safe. So if you imagine that you can't lift those arms, there's something really, really heavy, you will feel muscles in your back. You'll feel the scapula go down. And um, and that's what's supposed to happen before you lift your arms. But when you reach up to grab something from a cupboard, you don't. So the rest of your body has to get involved to balance you when it should be the core that's balancing you. So that's the heavy concept. Lift it, imagining that it's heavy when you lift. You can do the same thing if you're doing abduction. If you're lifting your arms to the side, you can still think, oh, I've got some tubing strapped around my torso and my arms, and I can't lift them. And then you go ahead and try. And what happens when you imagine that you can't do it is that there's those muscles that are supposed to fire, and then they get that memory, and then they're tingling and excited because they're going to get used. And so after you imagine you can't do it, and then you do it, the muscles fire in the proper sequence. So that's basically the heavy concept. We can do the same thing with shoulder rotation. Imagine that there's tubing tied around your forearms, holding them together, and you can't pull them apart, and you'll feel your shoulder blades squeeze together. That's what should happen. The one precaution is that shoulder blades should be lightly down before you try to do this, because if you do it up here, it's not going to be healthy for you. So I usually, with arms, I use two arms first, and then I will try one arm. It's called the heavy concept, but basically it's neuromuscular retraining. It reteaches the brain and the muscles how to fire in the right sequence. Then I have something called reverse heavy. So if your arms are up here and you imagine there's tubing, let's put it right above the elbow here, and it's anchored to the ceiling, and you're trying to pull your arms down, but they won't come down, you'll feel your shoulder blades go up a little bit. That's deep tissue. That's heavy concept, although that's what I call reverse heavy. And I find that calling it a heavy and reverse heavy, everybody understands it, where if I call it neuromuscular retraining, I can't even say those words. So I don't know what we could do. There are a couple considerations that I want you to think of before you use them. First of all, be aware it's the brain. If you actually put a weight on the arm somewhere and tried to lift, or you strapped your arms down and tried to lift, then we tend to still work from the outside in. So then we're still going to be using our head and the rest of our body to make those things happen. So it's very cognitive, which means you can't repeat a lot of them because we're not very good at still thinking about one thing for a long period of time. So also, I would only do one thing. I wouldn't do heavy and reverse heavy and heavy, or heavy and then heavy, and it's too confusing cognitively. Also, I do it very slowly to get started because those muscles need a little wakening up. And you know how hard it is to get up in the morning. And finally, the breath. When it's heavy or reverse heavy, that's the exhalation. I have had clients who will think heavy and they'll go, and there's no breath at all. That's very dangerous. That's a really dangerous thing for anybody who has blood pressure issues or cardiac issues or anything like that. So make sure you're exhaling when it's heavy, but if you're doing reverse heavy, exhale here. Okay, now we're going to hear from Connie. She is so smart and so articulate. You're going to love this.
Thanks, Ruth. I think really reinforcing the fact that alignment is so important. There's a little exercise that I do often with people that I'm working with to illustrate for them how important it is to have things stacked up properly for function. And I know that was part of your first session on shoulders, and it's also part of what you're talking about right now, is to get things lined up and firing properly. So assuming no one has any restrictions, I'm going to get you to do a little experiment right where you're sitting in your chair. So you get into kind of grade 10 in math class sort of posture with the head kind of leaned forward and the shoulders rounded, and like you really don't want to be here and you aren't awake yet in any way. And in that position, very slowly look over one shoulder, just very slowly, and notice the farthest thing that you can see. Just notice it. Then come back to the center. You're still in the slumpy grade 10 in math class. Not picking on grade 10s, but I've been there. I know what it's like. And then you're going the other way and just noticing what's the farthest thing you can see, just with that range of motion in your neck, and you're not moving your torso. I'm going to add to the little test here, and that is that you're going to raise one arm as high as you're able to do. Presuming you can do that, you're still holding on to that slumpy, not well-aligned posture. And in your peripheral vision, just look at how high your hand or your arm are. So without raising your head, just look with your eyes. If you can even see your hand, I can see mine, it's not very high. Bring it down, and then I'm going to do the other side. So this is just a little pre-test. And I'm looking with my peripheral vision, how high am I getting my hand? I'm not trying to force anything. I'm just going up as high as I comfortably can. And then I drop it back down. And then we're going to do a little realignment exercise. So you're going to feel where your shoulders are at and do a few little circles, and then drop your shoulders nice and low and pull your chin back in just a little bit, and then let it relax slightly. So now you want to feel like you're sitting really straight and tall, and your ears are over your shoulders, which are over your hips. Not stiff tin soldier, just nicely stacked up. In that position, we're going to repeat the test. So I want you to look over one shoulder again and notice the farthest thing you can see. Okay. Come center front slowly and look over the other shoulder. Notice whether you can see any farther with that range of motion than you could the first time.
Oh, yeah.
Big difference for me, right? And then raise one arm. And I can't even see it in my peripheral vision anymore, but I can see myself on the screen, and I know, wow, that arm's right up by my ear now, and I could not have gotten it there before in that other position. And again, the other side. So I'm going to guess that you're at least a little bit better in terms of function than you were when we were in the slumpy posture. And the slumpy posture can just be habit, it can be pain, it can be the end of the day and you're just tired and you're thinking it's too much work to line myself up properly. But when you do line yourself up properly, it's actually less work. So building that habit cognitively is really important. Now, the other thing that's a bit of a stumbling block for people is that often they're so tight in some musculature that when we ask them for scapular set, we ask them to maybe roll the shoulders up, back, and down and drop them nice and low on the rib cage, that they're restricted by some tight tissues that won't let them do that. As much as they try, they can't get there. So I have a couple of self-aqua stretch techniques that can be used anywhere. The word aqua is in there for water, but this works great in the workplace. Don't do it while you're driving, but you can do it anywhere you got your hands free, and you can just attend to yourself for a little while. So I'm going to start the strip show here. Just take this off, so if you're looking at where I'm putting my hands, you can see better. So first of all, just play again. play. How do the shoulders feel?
Yep.
How does your neck feel for movement? Play around, see how things feel. I'd also like you to try to do the "Tada, aren't I wonderful" stretch, where you have your arms just pulled back and your chest open, and just see how tight or not tight you feel across the chest wall. And then just relax everything. We'll start with the upper part of the shoulder. So looking at the upper trapezius muscles and just palpate that, feel that with the pads of your fingers. And you're looking just to feel, is there anything gnarly back there? Feels a little hard, a little crunchy when you press on it. And then what I want you to do, you may have to get free of your desk or your chair a little bit, but I want you to move the shoulder around and move the neck around, trying to get the shoulder blade lower with respect to the ear. So you're moving maybe forward, back, up, down, but your goal is to get the shoulder farther down. I'm putting enough pressure in with the pads of my fingers that this hand's going to get tired in about 30 seconds to a minute, because I'm trying to put about 5 pounds of pressure in there on the top of my shoulder. And I'm going to move my neck, and I'm going to move my shoulder blade forward and back and drop that elbow toward the floor, pull my ear away from my shoulder. Anywhere you want to move is the right way to move. You do that basically until your pressing hand gets tired. And like I said, because it's isometric, that happens in about 30 seconds for me. Now just move both shoulders and move your neck and see if it feels different one side to the other. I have better range on this side now for neck movement than I had. And I have the better ability to get that shoulder down a little bit lower. And how long did it take? 30 seconds? A minute? If it's super crunchy and tight, then I can do it a couple times in a row, giving my pressing hand a rest. Let's do it on the other side so you're not crooked. Otherwise, your clothes are going to fit funny all day. So we're going to do the same thing on the other side. You're going to find what you feel is the tightest spot. And nice deep breathing helps. And you're going to press into that area with as much pressure as your pressing hand can give you. And my goal is to work that shoulder blade lower, straight down toward the floor, not in front of me, but down away from the ear. Think of it traveling down your rib cage. And when I've had enough on my pressing hand, I move again and play and move my neck. And is it better, worse, or the same? Those are the questions you ask yourself. Am I moving more freely? Does it feel like I'm lining my shoulders up a little bit better? It works for me. We're all slightly different. Some people will have miraculous changes. Others will go like, meh, okay, maybe I notice a little something. So it depends on your tissues in your body, what you feel. The other thing I like to loosen up, maybe a bit more light here, I like to loosen up the pectoral muscles, and particularly pec minor. And pec minor is a crazy little chicken fillet thing that we have. It attaches kind of here from the chest to the scapula. And so what it does is it pulls the shoulder blade up and over. So if you see people whose shoulder blades look like they're kind of wandering up over their rib cage, or if you feel that's happening with you, that's often that pec minor is very tight. And so people are doing great stretches for pec major, but pec minor isn't really getting any attention. And it's one of the ones that will keep you from being able to get your shoulder blades down into a good scapular set. And we know that affects function because you just proved it to yourself, right? So here's my release for that. I put the thumb in the little notch at the top of the manubrium, right between the ends of the two clavicles. So there's the ends of my clavicles. There's that little notch. And I put my thumb there. And I'm going to go, because my fingers are pointing that way, I'm going to do this side first. So what I do is I feel the clavicle with my index, and then I go below the clavicle until I'm into soft tissue. So I want to feel the intercostal muscles. I'm on the pec, but I want to press like I'm pressing right into the muscles between the ribs. And I put my two fingers adjacent to each other, so I have a little line of pressure that's almost an inch long. Okay, so I'm pressing into there, and it should feel a little bit ouchy, but you're not on bone, you're on soft tissue. Now again, move your shoulder blade. Try to get your shoulder blade down. You can even look away a little bit. As you drop your shoulder blade, look away. I'll do a couple of repetitions of that. Then I'm going to move the fingers over one finger width, finger placement width. So I have the two fingers together like that. I did the first position. Now I'm going over adjacent to that first position. I'm still keeping the thumb where I was. I'm not pressing with the thumb. It's just a marker. It's just an anchor point. So I go over to the next position out, and I do that, roll the shoulder blade down as low as I can get it. Move the neck how you want to, but I find looking away can really help me get that moving. I do a few repetitions of that, and then I move my fingers over one more width. By the time for my body size and my hand size, by the time I'm over to the third position, the third place out, I'm on pec minor. And you will start to feel it as this weird little, it'll just feel different, I think, you tell me, but I can feel that I'm pressing on pec minor. I can feel that different sensation in the tissue. And it's more of an up-down muscle than it is an out radial muscle that pec major is. So I'm moving that shoulder blade down, I'm moving my neck away, pressing as much as I can tolerate, and then I'm going to do it again. And so I'm going to get out right to the front of the deltoid. So right out to the end of where I can press there. With that rotation, drop, rotation, drop, rotation, drop, look away. And breathing. And you might feel a little kind of bruised, a little pressed on there. But I want you now to try the two arms, open the two sides, move the two shoulder blades, and see if there's any difference between the mobility you feel on the side you worked on versus the one you didn't work on.
Mm.
The same, different, feels different, right? It feels freer to me. It might feel a little warm. It feels a little more open. Now, again, so we can practice and so that you don't, even, there you go. So you can do it much more quickly this time because you know what you're doing. So the thumb is in there. I put the two fingers below the clavicle on soft tissue. I'm pressing in with about as much pressure as I can tolerate. I do a couple repetitions. I go out to the next space adjacent to that. And I press in. And I move. I breathe. And I go again. And really, it only takes me a minute or less to get all the way out on that one side. And then I play and I move. And I see if I can roll my shoulders up, back, and down and get them to a more free, more set location on my rib cage. There's more we can do for the neck, but that's maybe another whole session. So, and you can let me know, and you can give comments back about it, whether or not this helped you, how you would use this. This can be done on land. If you do it in the water, of course, is supporting your arms, which is nice. But you can do it sitting in a chair. You can do it anywhere. It's a great little thing to do after a day at your desk. If you're driving a long way, when you take your break and stop driving, do your stretches, move around, play, and do these little mobilizations that will help you set your shoulders better, because when they're set where they should be, guess what? You can shoulder check more safely. You're a safer driver because you have mobility in your neck and your shoulders.
This is wonderful.
Great.
This is great. I did not realize that the pec minor was restricting my shoulders. I mean, it's like a big light bulb going on for me. And not only did you tell me that, but you taught me how to take care of it. And this one up here is way better.
Good.
This one wasn't bad. This one, oh my gosh. Yeah, way better just from holding it and moving it.
Yeah, and it's different than massage. So when we think of massage is passive. It's not bad, it's not wrong, but this is active. And so what I think, the reason I think that it has such a good grasp on helping the muscle to let go is because it's neuromuscular. We're working with the motor unit. We're working with the firing of the muscle as well as the fascia on the muscle. And that has a different feeling and a different result than passive massage.
Awesome.
Yeah, it's so good. A lot of those moves, they're part of our Tai Chi miracle warm up, as my Tai Chi master calls it, but it's the moving and the willy-nilly that Ruth has and everything else. And I usually do that in the morning so I can, get up and get going, but it's great. It really is.
I stick it in at the end of every aqua class as well. I'll tell people, as you're leaving the pool, move however you want to move. Any kind of move you've wanted to do today and you haven't had the chance to do it yet, wiggle, squirm, pole dance, I don't care. Just move your body and breathe as you're leaving. And once people get over the kind of self-consciousness of moving in a silly way that's not the same as everybody else, they kind of get liberated by it. And just what you're talking about, Linda, right? You start to feel that, oh, that feels good. It feels like a breath of fresh air in my body. Everything wants to move better after I do that.
Oh, absolutely. Absolutely. And it's funny with the heavy concept in some of the classes that I teach, the people I teach for don't understand heavy concept. But when I'm teaching a class, they're anywhere from 75 to 95. So whether it's water or land, I have them work heavy concept. And they look at me like I'm crazy, but all of a sudden it's like they get it and things move a little bit easier. So I'm going to work more shoulders into it and see if that works for them better too.
Yeah, I could see it fitting with I Chi really well too. Ruth, do you use heavy in I Chi at all?
I don't use heavy in I Chi, but I use acupoints, which I was going to ask you. Do you, when you're finding these points, I know that Aqua Stretch has a set plan. You find them intuitively then, right? And they're probably a lot of
intuitively, but anatomically. So, I'm thinking about this is kind of the guided approach part of Aqua Stretch is, you move how you want to, you play, we identify the tight bit and we go after it. And then we move some more, right? This is more like anatomically, I know what's restricting stuff. So I will guide that approach across. And it gets all tied up in things like trigger points and the anatomical, acupressure points that people are talking about. But I'm kind of parking that because that's not my expertise. But I know anatomy, and I know where that pec minor comes through, and the fact that it's flipping hard to stretch your pec minor. Who's ever asked you to do that before? Even pec minor is tricky because it's a fan-shaped muscle. And it controls so many different actions across the body that really, unless you're going through it a range to stretch it, you're not getting all the fibers that you might. But pec minor gets completely ignored, and yet it's the little darling that's just keeping your shoulders creeping up over, keeping your shoulder blade on the way toward your chin.
Right. And Mary was talking before about people with heart problems. Mary's, go on.
I'm here. I'm here.
Good. Go on.
Okay. First of all, I want to say I agree with everything that Connie said, except watching the neck rotation or movement. Because if you've had an ACDF or an upper thoracic fusion, your head is not going to move like that, the neck. And so you have to be very careful because of those adjacent segments. Because if you've had an ACDF at levels 3 to 5, 5 and 6 are going to be failing, and possibly 2 and 3, which takes it up to the atlas. And when that happens, then the fusion is extended from the T1 up through to the atlas and maybe the axis, the C1. So I'd be very careful on that. As for the people with heart surgery, I have a friend that probably 6 weeks ago had a quadruple bypass. And talking to her last night, she is not allowed to raise her arms overhead until mid-November. Of course, she can't drive or do anything else. It's a very slow recovery. And I think this is because she has a tendency to get so much fluid in her chest area. And so I also know my sister is having the same problem, and she has to measure her fluids and her weight every day. And she has limits on her too. So there are some times that we have to realize who we're working with so that we know what we can do and what we can't. But I love what Connie did, because I have that problem constantly. Whenever I walk, that's where I get pain. And so combining that and the heavy concept helps to keep the scapula down, and massaging back here and now in the pec minor will help in releasing any of that tension that you tend to hold or that you increase. Because as you all know, I have a lot of fusions in my body. And so they don't allow this movement to naturally occur. So I have to work with it. So those are my comments.
Thank you. And I believe Connie and everyone who works in the field, Connie goes with a good pain, bad pain, in which she can explain, but we all have to modify things for each person. And I believe, yeah, we're all aware of that, but thanks for bringing it up. Connie, want to jump in?
Yeah, just saying that what the instructions you give are so important, and thank you for raising that, Mary. So it isn't move like me, it's move how you want to move. And if someone's coming in with a rich health history of issues and surgeries, they're going to be one hopes aware of where their limitations are. But if they aren't, then of course you're going to start very slowly with just getting them to explore, what were you told that is okay for you to do? What have you learned is not okay for you to do? And you're going to stay within that parameter. So you really, really take your time. This isn't the kind of thing I'm going to throw at a group class with 30 or 40 people in it.
Yeah.
And if you're working one-to-one, then you're going to have the opportunity to really, I mean, you could, assuming they're all relatively healthy and able to move fairly well. But it's when you're working one-to-one or with a very small group in a therapy setting that I think then Mary can certainly be, helping guide somebody to explore their possible safe ranges that they can move through to
Yeah.
start getting their body lined up as well as they can for their new normal.
And can you explain good pain, bad pain, so that if
Oh, yeah.
someone out there is trying this, they know when to stop?
Yeah, so no bad pain, and that's kind of an underlining theme between of everything I do, whether it's a group aqua fitness class, whether it's a therapeutic aqua class, or training therapists. And the idea is that good pain is something that maybe feels a little tender, but you can breathe through it, you can move through it. It might feel a little like this might give you a little bit of good pain. It feels a little bit tight and cranky when you press on it, but the more you move, the better it feels, and you can tell that it's going in the right direction. Bad pain is something that's sharp pain that feels like it's more than 6 out of 10 on the 0 to 10 pain scale, where 10 is I'm in the hospital going unconscious kind of pain, and 0 is I'm sitting on the couch eating Doritos and I can't quite reach the bag, that kind of pain. So you're trying to keep below 6, which is that's kind of the break-off point where you can't really breathe through the pain, you can't relax, it feels sharp or stabbing or wrong. And if you've had injuries and surgeries, you often know through experience of recovery that I go to do this with my hip or my knee or my shoulder and it feels wrong. So my brain's going to stop me right away and make sure that I don't do that. If you got somebody who's a real gung-ho person, you're going to have to really counsel them about going slowly and exploring gently.
Excellent. Thank you. Does anyone else have a comment before we wrap up? I want to thank Connie, and Mary and Linda for being here for their comments. But Connie, your information on Aqua Stretch, that's Land Stretch also, is excellent. And I feel like today I've gained a lot of freedom of movement, and I really appreciate it. Thank you very much.
Thanks for the opportunity.
Thank you.
Thank you. All right. See you, everybody. Bye.
Bye.